In today's inspirational, I would like to talk a little bit about locking of joints. I'm not talking about the spine right now, I'm just talking about the extremities. But let's imagine the patient is doing some kind of activity and suddenly his elbow locks. His elbow is locked and he doesn't reach full extension anymore. Or in the knee we can have something similar. Some kind of trauma and suddenly the knee locks. In the hip we can also have something similar, that the patient has a kind of locking feeling in the hip. Yeah, of course, in the knee we are familiar with some kind of meniscal problems which can cause this acute kind of locking. But there's also another option which is not so frequent, but which is also nice to recognize. In the elbow, in the hip, in the knee, even in the foot. But in the foot, quite often the patient doesn't describe a real locking, he describes more a kind of instability feeling and twinges, very intermittent, irregular twinges. But what can we think of? Locking, the joint is blocked in one direction and is free in another direction. In combination with twinges, with giving way, well, another option is a kind of internal derangement, a loose body. And if the loose body is not bony, so if it's not visible on medical imaging, then we have an option to perform some manipulation technique with this patient to, let's say, get rid of this kind of loose body so that it moves somewhere else in the joint. As celiacs used to describe it in the past, it shifts into a silent zone where it doesn't interfere anymore with the mobility of the joint. But yeah, sometimes that's a very good idea to perform some kind of manipulation technique with this kind of patients, where you have very good and fast results. So keep in mind the concept of a loose body.